Everybody, thank you for joining us for our fourth installment of the CRISP Summer Webinar Series. My name is Michelle Rubin, and I'll be your guide through the webinar series. This is an opportunity for you, our users, to learn about CRISP, how we can help you and your patients, and directly interact with CRISP staff. If you missed the first couple of webinars, go to YouTube, find our channel, CRISP Health. You can also find the recordings on the Events and Webinars page of our website, crisphealth.org. A few housekeeping items. Everyone is on mute. If you have any questions along the way, please use the chat box on the right. Our presenter will answer them at the end of the presentation and get to as many as possible. Feel free to type the questions in as you think of them along the way. We might not get to all of the questions, so we'll consolidate questions and answers and send them out to this group and post them on our website. This webinar is being recorded, so if you miss anything, don't fret. We'll distribute the slides, recordings, and Q&A and post them on our website, crisphealth.org. To find the recordings and slides, go to Resources, then choose the option Events and Webinars. Scroll down the page for the on-demand webinar playlist. Also, look out for a brief survey. Please fill it out so we can improve the series. The comments so far have been very helpful. Today's webinar is an introduction to the nuts and bolts and how to navigate the unified landing page. We'll also have a sneak preview into new features that will be available shortly. Our presenter today is Ryan Bramble, Senior Director of Product Development and Executive Director of CRISP DC. Ryan, take it away.
Thanks, Michelle. Thanks everybody for joining today. I am going to go over the unified landing page and some of the features that exist today inside the unified landing page. It's our one-stop shop for where users can go into the different systems that CRISP offers and access all of our tools. We are over time adding more and more things to the unified landing page, so I'm also going to go through some of the new things that are coming to the ULP. Especially those that are coming up in the next few months. Some things that you now have to log in separately to are getting moved over to the ULP. So definitely going to walk through those things. This is going to be a little bit in the weeds, so we're going to be digging through screens and showing exactly how to do different things. So please, as I go along, type questions into that chat box, and Michelle will get them to me so that I can answer them during the last half of the presentation. I am going to cover some things that have been covered briefly, and I'm going to cover some things briefly that have been covered in other webinar series videos. So please go check out our YouTube page if you haven't already, and see some of the previous webinars that we've done around PDMP, opioids, cybersecurity, etc., for some more detailed information about those topics. Okay, so overview: what is the unified landing page? So when CRISP started, we offered some web-based portals to do different things. So you had access to what we call the query portal to look up clinical results for the patients you're treating. We have a service called ENS, the Encounter Notification Service, which has its own portal where you can log in and see encounters and things related to specific encounters, as well as get notifications pushed to you when your patients are having events in one of the CRISP hospitals. And we had separate user interfaces for other things as well that smaller groups of users use. So the unified landing page concept is one where we want to eliminate all that burden that the users have to face, where they are needing to remember multiple passwords, multiple usernames, things you're already doing for other organizations, other sites, other portals, countless numbers of logins and passwords that folks have to remember. So we're trying to simplify that into one. Inside the unified landing page. You'll see it often abbreviated ULP as well, so the ULP and the unified landing page are the same thing. CRISP services that I'm going to go over here today are free to providers, as they've always been. There is some regional differences throughout some of these screens, which I'll talk briefly about. So if you're a user in the District of Columbia or West Virginia, it might be a little bit different experience than what's in Maryland, but I'll try and point those things out as I go along, but we can also answer those questions another time. After we get some of the new features I'm going to talk about today into the system, we'll certainly be doing another demo webinar of those of the new features in the new system as those things happen. All right, so these are some of the things I'm going to go through today. I'm going to, as I said, briefly touch on the PDMP, but I think we've done a few videos on that in more detail. So again, check out our YouTube page for those. I'm going to talk a little bit about the query portal. That's the thing most of you are probably most familiar with. That's been in operation for some time now, probably close to 7 or 8 years. We've had the query portal as an offering where providers, anybody who's really treating a patient, could go in and look up labs, radiology reports, discharge summaries, etc. for the patients that they're treating. Snapshot is going to be relatively new for many of you. We have some folks using this today, but it's not widely deployed, so I'm going to talk through that. It's as its name describes, it's very much at a glance view at some critical information that you need for your patients. It doesn't require you to hunt through an entire medical record to find the things that are important in the moment when you're looking up Snapshot. And again, that has some region-specific stuff as well for users in different areas that CRISP serves. ENS Prompt, which you might be familiar with. ENS Prompt, we're moving that into the unified landing page, so making it easier to get to your ENS notifications. And then 2 new ENS features which are coming again towards the end of the summer. ENS Panel Loader, which will actually let you load your own patient panels. So I'll talk a little bit more about that later, because that process you may not be familiar with. And then something called Census View, which is just easier to show you. So I'll get to that when we get there. All right, so to log into the ULP, we tried to make this as easy as possible. Just go to ulp.crisphealth.org with your email address, username, typically an email address, and your password. At any point during the process, if you have trouble, you can always call our customer care team at 877-95-CRISP. Go on our website to get email information about how to email them, and also the phone numbers there if you forgot it. And they're happy to help you with this process. Would certainly encourage users that don't remember their password to go through the forgot password link first. That's usually a much easier way to get your password reset any time of day. So log into ulp.crisphealth.org. One thing I want to mention, so we have a couple of feedback spots throughout the unified landing page. So when you log in the upper right hand corner, you'll see an opportunity to click a feedback button. You can also go to our website and submit feedback. We want as much feedback as possible, so do not hesitate to provide any level of feedback, good, bad, really good, really bad. We're okay with any feedback. We want to get as much as possible. Your feedback is really what drives my development team's pipeline. So when we get a lot of requests about one thing or 2 things, it goes right in as a feature in our development process. For those of you familiar with the development process, we run an agile shop here, so we can turn around bug fixes relatively quickly. So we really encourage as much feedback as possible. This feedback portal also is secured, so you're allowed to submit PHI in here. So if you have a specific issue with specific patient's information, you can submit it through this process. So just fill out all the information here and provide that feedback, and we will certainly throw it into the review process we have here at CRISP to analyze new things as they come in. You can also always call, again, call our number, provide feedback over the phone as well. All right, so once you log in, you're going to be presented with this patient search screen. The patient search screen in the unified landing page is a little different than you might be used to with the query portal. While the demographics required, last name, first name, and date of birth, are pretty traditional for something along these lines, we are including in this patient search a match score. So a likelihood that the person you're looking for is in the list. So for instance, in this patient's example where we've typed in Grape as the last name, Gilbert, and the date of birth, you're seeing 2 potential matches here because the name is different on this one. It's not necessary, and some other information behind the scenes, it's not linked to the other one. And what we were finding is that sometimes people were missing data missing viewing data because there was discrepancies like this, usually a little more than this, that were keeping folks from looking at 2 different records. So we have included a match score as to what the algorithm thinks is the most likely person you're looking for. And then you just check this box, include, and you are allowed to look up the look at this patient's record in the different applications. One thing to note, if you're looking up their PDMP data, you can actually select both and combine them in the PDMP view. The other apps require just one patient be selected. We're working on potential options to allow multi-select in different applications. Right now, PDMP is the only application that allows the multi-select. So check what you want there, and then when you hit search apps, you'll have the option of which app you want to search for, which app you want to search the patient's record for. So query portal, PDMP, Snapshot, whatever you have access to. So the access is going to be based on your role and what services you are signed up for from CRISP. I'm going to briefly show the query portal. You've probably seen this before. This is really everything CRISP knows about the patient. It can be a little bit overwhelming, which is one of the reasons we've designed some of the new tools like Snapshot. But this is really everything for this test patient here that we have. So all their lab results, radiology reports, transcribed reports, meaning discharge summaries, history and physical, consult note, operative note, pretty much anything that's kind of dictated at a hospital and then transcribed and then signed by a provider. One thing to note is that CRISP gets final data. So preliminary data does not go into CRISP. So the discharge summary, for instance, has to be signed by a provider before it comes into CRISP. So that's important to note. If I wanted to view this operative report, I would click it, it would pop up, and I could read the details of this operation. Next, again, I won't spend too much time on the PDMP, but the PDMP, again, go back to our YouTube page and look at some of the previous videos on the PDMP. In Maryland, CRISP is the Prescription Drug Monitoring Program user interface for providers. This is going to be all Scheduled 2 through 5 drugs prescribed in Maryland. And then we have out-of-state connectivity. State by state, it kind of varies what's provided through that out-of-state connectivity. That happens through a hub that another organization manages. So in this view, the Maryland and interstate PDMP data comes in at the same time. And over here on the right-hand side, you'd see the state that drug comes from. So things that are coming soon. So patient snapshot. So again, some users have access to this now. Most of them are in the District of Columbia. Patient snapshot has regional variations. So folks in DC can look forward to accessing some of the data from claims in DC. In Maryland, we have folks that can access the care alerts. Briefly talk about that. This is meant to be an at-a-glance what's important for me to see at this patient. This is the one we've divided this into two screenshots. This is the left half of the screen, and this is the right half of the screen. I'm going to go down sort of side by side what's in what here. But basically, what you would see here, most up-to-date demographics. So if you haven't been able to touch your patient for a while, haven't been able to reach them, we have the most recent demographics here from the organizations that they've been to most recently. So the most recent phone number, for example. A care alert is something that a provider has written about a patient, usually saved for patients that are very complex, with specific instructions that previous doctor wants you to know about when you treat that patient. It also would potentially have overdose history if a patient had an overdose event at one of the area hospitals. That's the care alerts right now are a Maryland feature, and that's something you would see when this gets deployed in the next month or two. Also, we have a better look at encounters from ADT. So we are going to sort these, provide reason, diagnosis, discharge, disposition for every patient you look up. So you can actually better at a glance see the recent encounters a patient has, where they were, why they were there, and look and sort of set the look back on that as far as you want to. One thing here at the bottom that I think is pretty cool is the care team. So anybody that is using CRISP to get alerts when their patient goes to the hospital will show up here. So if let's just say I'm in the emergency department and my ED provider wants to know who my primary care physician is, or wants to know anyone who might have a relationship with me in the community, they can query me and they can look in this care team box. And my Bayside family as my primary care provider would be here. So would my PCP if that's provided by Bayside family. And I'm hovering over the care manager's name, but behind me is the care manager's name, and you could potentially even see that. So a lot of care management organizations are submitting lists to CRISP so that providers at a different organization, at a different setting, can actually look up and see, oh, this person's already in a care management program, this person's already in a congestive heart failure program, and reach out and coordinate care with me, and maybe even save a hospital admission because of it. So stay tuned for patient snapshot. We are moving ENS prompt into the unified landing page. This is going to be what you're used to if you're a prompt user. This is more of This is more for a user maybe in a practice or again in a care management organization that would be logged in and need to know when their patients are having visits. So on the left side here, this is kind of a Twitter feed almost of every encounter that comes in. It just comes up onto the top and where that patient was, why they're there, those kinds of things pop in here. And then on the right side of the screen, more details about that. You can download a list of all of your notifications here. The cool thing about Prompt is you can filter the list. So if you want to filter down to people just who have a lot of recent visits, or you want to filter down to people in certain programs, if you have a certain care manager responsible for 100 patients and another care manager responsible for another 100 patients, they can see their own lists. And then we have two more things to show you here as to what's coming soon. Panel loader. Right now, you have to submit a panel for the notification service. So if you want to receive alerts, if your patients go to the hospital, you submit that securely to CRISP. We are building a mechanism by which you can upload the panel at your own pace, your own frequency, potentially help you keep those panels more up to date more quickly. That process is a little bit involved, so we'll have more training of information available for that as that comes out. And then Census View is something that is been asked for a lot by folks. This is more of a at-a-glance again as we move towards at-a-glance information. This is at-a-glance information about where your patients are now. So based on your patient list, on the left-hand side, we will know who's still in the hospital, hasn't been discharged yet. In the middle, who's still in the ED, hasn't been discharged yet. And on the right, who's been recently discharged and where were they. This view is a little, it's more curated, a little easier to understand than the traditional prompt view, and I'm sure certain users inside your organizations would be interested in seeing it this way. All right, so as we mentioned at the top of the presentation, please submit your questions in the chat box. Michelle's going through them now and is sending them over to me, so I'm going to take a moment now to answer some of your questions as they come in. So the first question is, can you look someone up by medical record number? At the moment, you cannot look up someone by medical record number. That was a feature we had at one point in our past. We found that a lot of medical record numbers have zeros on the front or back end of the number, and that was confusing folks as to what number they should be using. We can certainly take that as a potential enhancement request to search by a number, and if the number sort of matches any number within the medical record number, we could use that, but at the moment you cannot search by medical record number. Second question, are there any plans to include patient information from the VA hospitals in CRISP? Great question. We've had conversations over the past years with the VA. The VA uses there are some national standards for interoperability. Without getting too deep in the weeds on those, the VA and the military health system and the other federal entities participate in those networks. Those networks are something we can interact with, but there are sort of more stringent legal and contract requirements to work with those organizations. So we don't have a lot of information from the VA in the system. The VA does use CRISP, and other federal entities do use CRISP to see information about the patients they're treating, but getting the data out of the VA has not happened at scale. VA is also going through an EHR project now, which we probably would have to wait till that completes to really get more information out of the VA. Third question, I'm in DC but don't seem to have access to Query Portal or Snapshot. So you should be able to get access to Query Portal. I would encourage you to contact our customer care team, 877-95-CRISP. The Snapshot is being rolled out in DC gradually. Right now it's been deployed to users of a certain program that's been administered by the Department of Healthcare Finance there. We are rolling it out to more users in the next month or two, and then hopefully more broader deployment towards the end of the year. But please give our customer care team a call. They can answer your question about the Query Portal access. Question 4 from a Maryland user, can I review a patient's medication list from the Query Portal? So you can review the controlled dangerous substances from the Query Portal by clicking on the PDMP tab. Non-controlled drugs are currently not in CRISP outside of the narrative form inside the discharge summary. So in the discharge instructions, you would see drugs that were prescribed on a discharge. We do not have a link to the non-controlled drugs. Typically that is through a company called SureScripts, which a lot of EMR vendors have an existing relationship with. and those drugs are accessible through EMRs that folks are running. We have not stood that integration up yet. We do have in DC, for the folks that are using the patient care snapshot, and we'll be using the patient care snapshot, we have claims, medications from claims. I could see that becoming something that comes more widespread throughout CRISP in the coming months or so, but at the moment it's just controlled drugs. Good question. Question 5, can I obtain patients' diagnostic imaging report, like a colonoscopy or mammogram, if they completed these procedures in another facility? Yes. So please go to our website, crisphealth.org, and click on Connected Providers. Any facility there that has the box for radiology reports checked, you will be able to read the report for that patient's procedure. It includes almost all of the hospitals, and it includes the major radiology centers in the region, like Advanced, Community, Progressive, those types of centers. So the full list is on the website. The report will be there once it's finalized. We are also working on image exchange, so a handful of hospitals, about half of the hospitals in Maryland, actually also submit the actual images, and you're able to view those from the query portal as well. If you click on the radiology report and you see a view image button, you'll be able to see that image from the organization that has generated it. That just a word of caution, when you're looking at an image, it takes a little bit of time to download because these are very big files. But you should be able to see that image and interact with it. It's potentially another candidate for a future webinar, as that's a pretty cool project. The image exchange and seeing how that works would be valuable, I think. All right. One question here. There are still hospitals who are not uploading information to CRISP in Maryland. Are there plans to getting those hospitals to participate? Absolutely. We have good relationships with all the hospitals, and typically at this point, if there are feeds that are not part of CRISP, that information, it's usually a technical limitation as to why the organization can't load that feed. We do work with the hospitals to understand their filtering logic and those types of things to make sure we get a complete record from each hospital. We have account managers, outreach folks who are working with the hospitals on a daily basis, trying to complete out the feeds once we can. As you know, hospitals tend to go through migrations and project technology upgrades. So as those things happen, we re-engage with the hospital to see if we can get a feed that they once couldn't generate out into CRISP. Question, is it recommended that nurses use CRISP, or is it only for doctors? So CRISP is for anyone who has a treatment relationship or care coordination or care management relationship with a patient. So nurses absolutely should be using CRISP. The rules on how to register are pretty much, if you're a licensed health professional, you can get access to CRISP, and even if you're not, you can be a delegate of a licensed health professional. So if you're a smaller provider organization and you have one doc and one support staff, the doctor can actually delegate access to the support staff. Nurses can get access straight away, and we'd encourage them to get access as much as possible. CRISP is not currently saving our layout configurations of clinical information from one session to the next. Is that going to be addressed in the near future? Yes. So as I pointed out before, the feedback is so important. That was one piece of feedback we got loud and clear. It is currently in our development pipeline. I believe it's in the next sprint, which puts it about 2 to 4 weeks out. So we are actively working on that issue now. And thanks for the question. Keep us honest on that, please. Let's see. Is PDMP going to add methadone clinics to their database? So I actually don't know the answer to that question. That would be one for our PDMP expert, and we can certainly get that answer from her. It might be in one of the previous videos that they uploaded. I don't know the answer to that, but we can certainly find the right resource for you on that one. So one last question. Is there a search feature that can take a provider directly to the information needed? So I don't fully understand the question, but basically right now the search in CRISP for the unified landing page for the query portal, you have to basically look up the patient, and then you'll see either the snapshot at a glance view, or you'll see the entire record in the query portal. What we are doing is, and this is a little further out, but it's okay to talk about it here, we are building interfaces that are more specific to the type of user. So we're looking to figure out a way to group all of the cardiac information together, for instance. And that might be one way where a cardiologist might only care about certain things, and they would see a specific cardiology view of CRISP data. So that's one way we could get you faster to the information you need based on who you are. ENS, the notification service, certainly we're pushing that to you, and hopefully that gets right to you. But if the person who suggested this question has some ideas, we're certainly love to hear about them and get them into the development pipeline. How would I obtain access to CRISP? So easiest way to walk through that process is to go to our website. There's a button on our website that basically says want to register for CRISP. So please hit that button and that'll walk you through the process. As I mentioned, the customer care team's always here to help you walk through that process, 877-95-CRISP. And they can help you do that. There are some organizational requirements and there's some individual requirements. So what we do is try and right away identify a primary point of contact for the organization that we can work with to make sure we get all of the right things checked off and that the experience of onboarding is as positive as it can be. All right, it looks like we are just about out of time, so please continue to submit feedback to us as you get it, as you see it. Use our feedback portal, use our toll-free number to contact us. Next week, we will have our clinical advisor here talking about ways to apply the data that's found in the tools I just mentioned to day-to-day clinical practice, really talk about getting things into the workflow. The theme for CRISP, every summer, the team gets together and decides what should our theme be for the next 12 months. And the theme for the next 12 months is to really improve the way we are getting data into your workflow to help you use the systems well. And so we want to be much more of an embedded experience inside what you're already doing, and less I have to go over here to this separate portal to do it. So think about that. Think about questions for that before the next webinar with our clinical advisor. Thank you all for taking the time to watch this today. Really appreciate it, and look forward to talking with some of you soon. Thanks.